pregnancy after 4 is risky. That's the revelation by Executive Secretary of the National Population Council, Dr. Letitia Appiah. The revelation comes as the council works towards helping Ghana manage its population well and deal with the associated issues of overpopulation. Let's have a chat on this. I'm joined in the studio now by the Executive Secretary herself, Dr. Mrs. Letitia Appiah. Ma'am, thanks for joining us.
Thanks for having me.
So, at the moment, what's our population?
Well, the population per the Ghana Statistical Survey, it's about 27 million.
Is this a worry? Is this a bad thing?
Population is not bad because you need a human resource. Indeed, the human resource is the most important resource of any country. It is not the population per se, but it's the structure. The structure is more important than the number. You know, China is so big. Meanwhile, they had their one-child policy and then they're reversing to 2. So it is the population structure, not the absolute numbers.
So what's the concern about our population structure?
Our population structure with a growth rate of 2.5, it means that the population is very, very youthful. And if the population is youthful, it means expenditure is very high, consumption is big. Then savings are a problem, development is an issue. That is the relationship between.
Well, I'm reminded of some studies that have already been carried out where even though we have a general unemployment figure of 8%, according to the Ghana Statistical Service, the UN has also done its survey, and the unemployment among the youth is 47%. So, again, there seems to be a big, and this is a general African problem where we have over 200 million young people. We can't find jobs for them. But it's been argued that why not expand our economy? Why not expand our infrastructure to take on these people rather than have a policy to try and limit the number of births we have?
Yeah, it is good if we can do that. But you see, we always follow those who have succeeded. And that is not what they did. You know, you will look at the Asian tigers we always compare ourselves to. Mauritius is another beautiful country. Barbados is another country. We all had the same growth rate of about between 3 and 4 in the 1960s. But then they realized that with that growth rate, it would be very, very difficult to develop. So they worked on the population. So they instituted population management and brought the growth rate down. And we know where they are now. You see, if you look at those countries, the increase, for instance, in the Asian countries were between 2 and 2.5 times. None above 3. But Ghana, the growth rate, I mean, we multiplied about 4 times, which means that it is difficult to catch up.
That's from independence to now.
Yes, from independence to now. Even it's even more than 4 times now. This is up to 19,
because we started
2010.
off with our 5 million.
Yes.
Now we are about 26 to 27.
Exactly. Exactly. You know, meanwhile, other countries started off, for instance, Singapore started off about 2 million, and they are now 5 million. So you see, it's the rate of growth. The rate of growth is critical.
So what are these population management policies that you suggest?
Well, population management policies have always been in place. Ghana has always implemented. And look at statistics, for instance, the Ghana Statistical Service churns out. Teenage pregnancy is very high. And teenage pregnancy, you know, a fertile girl who starts pregnancy early has a chance of delivering so many children. You understand? And if you start giving birth at 18, what skills will you have acquired to be able to take care of even one child, let alone 2, 3, and 4? So then the quality of the human resource is being compromised because the primary responsibility of any child is I mean, the parent has the primary responsibility, and if the child is 18 years. I
mean, for teenage pregnancy, we can all agree that for children who are not old enough to take care of other children, it won't be advisable. So I think it's something that the country is already working in a way. We've seen some education in the public to an extent. But beyond that, what are these other more creative methods of managing the population?
Yes, one important measure, I mean, that important intervention is making family planning easily accessible, available, and free. Developed countries have free family planning because they know that when you offer reproductive health services to women, it actually decreases your health bill. The health bill actually comes down because it takes care of all the unwanted pregnancies, it takes care of all the abortions and its complications. It reduces maternal mortality. Because 20% of our maternal mortality is due to abortions, abortion-related, and which means that the people wanted family planning, but probably they couldn't have access to it.
Well, so again, it comes down to what you are being quoted to have said earlier, that it would be advisable for families, for instance, to not give birth after 4 children.
Well, after 4 children, you know, the higher the order, the riskier. This is from a health point of view. You understand? The higher the birth order, the riskier the birth. So then, because you have a lot of maternal mortalities and morbidities in the higher order pregnancies.
Which one is that? Please educate us. A morbidity.
Morbidities. Morbidities are diseases out of it. We have this obstetric fistulas.
Okay.
We have chronic renal failure. We have even depression. We have psychosis. We have so many morbidities associated with pregnancy. But we just look at the mortality. We don't look at the morbidities. But for every single mortality, there are about 30 morbidities that we are not looking at.
Interesting. So, but you see, again, it comes down to this preference, and it comes down to the real meat of the issue, because a lot of people you would ask a lot of people, and they will say the population is not a problem. If I have 5, 6 children, I can take care of them. I'm economically independent. Why should I manage the number of children I want to give birth to?
You see, you are talking from Accra. You're not talking from the rural areas. When you go to the rural areas and you see women with 4, 5, 6 children. I was in the rural area once. I saw a malnourished child. I told the father that this child is malnourished, and he said, no, that's how they are. You see, malnutrition is very pervasive. You can have a whole community malnourished, so the children all look alike, and then they think that that is the norm. You understand? And if you are malnourished, you are physically deficient, cognitively impaired, so then you cannot even do manual work well, neither can you do cognitive work well. So then the human resource is compromised. When we talk about Ghana, Ghana is not Accra and Kumasi and Takoradi.
But you see, is the issue of malnutrition a population issue? Because if you go to a simple rural area, for instance, a lot of these rural areas have grown on subsistence. A lot of these rural areas actually harness the human resource they get from large families by going to the farms. So in a setting like that, can we really blame overpopulation for an issue like malnutrition?
Yes, and also that's the issue. Talk about sustenance on the farm. So which means that the farms are so smallly divided that even the productivity of the farms are compromised, because the farmers need to leave the soil to fallow so that it can have better yield. You understand? So then even that, the overpopulation has a problem especially even in the rural areas.
But you see, the concept of leaving a farm to fallow, for instance, that is something that is constant whether or not you have a large family. Whether you have 4 or 8 children, you will need to eat every day of the year. Whether or not you have 4 or 8 children, you will need to leave the land to fallow. So again, it seems like there may be a challenge relating that to an overpopulation, because these are places that thrived on large families so that they could use the families to farm.
So what happened to technology? What happened to technology? I think technology is supposed to enhance whatever we do. You understand? Technology is supposed to enhance whatever we do. Gone are those days when you needed large families to farm. Now you can have one small little boy manning a big truck to farm a big land, which means that skill acquisition is critical. If you're able to give skill acquisition to the population, then they can use the trucks. If not, then they'll have to do the manual. And we can't compete in the global world using manual in the 20th century.
So there are actually countries that have benefited from having a large population. A country like Nigeria, for instance, has a huge economy because of their population. And so you can go to a place like that and they have a large market that they can sell cars. They can produce in large quantities because that market is there. And if you take a bank like Zenith Bank, they have about 40 million customers. They've been able to grow into a superpower because of their numbers. Why don't we rather take advantage of our population rather than look at ways to manage it?
You see, there's an indicator called the median age. The median age in Ghana is about 21 years, which means that half of Ghanaians is 21 years. How many of them can buy cars? How many 21-year-olds can buy cars? You understand? The median age you're talking about Nigeria is about 19 years. How many of the 19-year-olds can buy cars? You know, so the numbers are okay, but then the quality of the numbers is very, very important. Talking about the banking sector, how many of our rural folks have their monies in the bank? Let's go even to religion, religious organizations. Look at the collections in Accra compared to those in my villages. How are they contributing? You get it. Look at the insurance industry. Penetration is just 2%. Because, I mean, you cannot insure anything if you are hard up. Look at the banking industry. We are not saving enough because we haven't finished consuming.
Is it a problem of we don't have enough money, that's why we are not saving? Because the bankers will tell you that we have a large informal economy out there that is yet to be tapped and yet to be harnessed because we don't have an identification system or an addressing system. You
see, for population, you have to bring it down to the family level. You have to look at it at the family level because population has just 3 determinants: fertility, mortality, and migration. And that is what every country uses to manage their population. We have reducing mortality, we have stalled fertility, so we're having so many people. Look at a family, for instance. I have 3 girls. I don't think that on my salary, if I had 6 girls, they would have been where they are, and I would also have been where I am. No. Quality will surely be compromised. Everybody will be stressed out compared to a family where you have a mother, father, and few children. Why is it that when you are going to build a house, you always plan for that? You always plan, and you don't just start building a 10-bedroom when you can only afford 2 bedroom. You get it. So the quality is important. You have to plan for the number of children you can comfortably take care of. You go around the shore, they are selling children for less than 30 Ghana cedis. I think it's an indictment on the country, which means that the people really didn't need the children because there is nobody who will go for fertility treatment and sell that child. I haven't seen that before. Or any couple who will go for fertility treatment, have a baby, and maltreat the child, defile the child, sell the child for fishing, leave the child at 10 years to practice prostitution to take care of herself.
Again, they'll say it's because we are in a country that is poorly run, and that's why we have problems like this.
Well, poorly run, but then we also need to have responsible people. The leaders we have are not from space. The leaders we have are from homes, which means that if you claim that we have poor leaders,
it's not my claim. I'm just asking questions
yes,
based on the position that you are bringing up.
I understand, but we are from homes. I think that we need to clarify our values as a country. What defines us? China had its issue. Probably the one-child policy is to put premium on the child. Because if you have one child, there's no way you're not going to take care of that child. They implemented that. Abate is, of course, some negative aspect of it. But how different is it from we having the children and maltreating them? They say we can't take care of the children, so let's have the number we can take care of. And we are saying we want to have the number of children we can't take care of and maltreat them. I don't know which is better.
Okay, earlier you were giving us the median age for Nigeria being 19 years. Yes. Do we have those statistics for Ghana?
Yes, we have about 21 years. We are slightly better than Nigeria. And you see, and that informs migration. You know, in the 80s, when Nigeria was relatively better than Ghana, we were migrating to Nigeria. Now, it seems to be the other way around. Because the economy, Ghana relatively, it's okay. Nigeria has a big problem with the population. The dependency ratio in Nigeria is higher than in Ghana.
And that's why they are coming in. It's interesting because some would say that the problem of Nigeria is corruption and their inability to manage the huge oil resources they have. But, you know, your perspective also brings a lot on the table. And finally, how can we deal with this problem? Is it, what are the specific policies, if you are looking at population management, that we can use to deal with this issue?
Yeah, thank you so much. You see, for me, I think we have a lot of policies. Policies are good. Application may differ from, place to place. But one policy I like, which we all fought initially, was the ECG metering. You get it? ECG gives us a lifeline. It gives us a lifeline so that all poor people can access electricity. But then above the lifeline, you pay. you pay with, at a higher rate, you understand? So our population policy, you know, the National Population Council is under the Office of the President. Our population policy stipulates that we need to have a total fertility rate of 3 by the year 2020. That's what we want to get to. Currently, we are 4.2. But for me, what we need to do is to make sure that women who want family planning have access to it. Because when abortions are going up, it means that there's a big need for family planning. Tunisia was the first African Arab country to have a population policy. And what they did, they actually rolled out family planning with the Muslims supporting, religious authorities supporting, rolled out family planning. They had mobile clinics everywhere. Everywhere you went, like now what we have is it Nkumbaji or something all over the place. Nkumbaji all over the place. They had family planning, advocacy all over the place. Service provision was there. Logistics was there. They voted out money for family planning. Family planning was not left to donors. That is a serious issue. It should be country owned.
Right. So let's look a bit at what you said. I know I said those will be your final words, but this just bounced up about this issue of migration of Nigerians to Ghana. Of course, you heard the story we just did before, where it has created some issues. And what would you say is in Ghana that has made it so different? Because again, our median age you were mentioning is 21, and Nigeria's median age is 19. That means that technically we are not so different.
Yeah, we are not so different, but we are slightly better off. Why would people from the rural areas move to Accra? Why would we move from Ghana to Europe, to America? Why? It's the same. You know, people want better lives. People want better lives. So they will move to where they think they can find a better life. And migration is one very key determinant of population. That is what everybody is using. You know, the Westerners are aging. So now they are making migration very friendly.
But you know, like I asked earlier, it has been argued that it's about the expansion of the infrastructure that we have and making this economy better. I mean, you were making the point that it's not just a matter of living in looking at issues in Accra, but if you were able to create growth poles, for instance, in other major cities across the country, we would find people migrating to those other urban areas rather than causing a glut in places like Accra.
Yes, of course. Population management is it's very complex, and it has so many factors. You understand? It has a pull and the push factors. You know, of course, if you build industries in the rural areas, you make easily accessible for, even workers to go there and bring out their children. They will move in there. They will surely move in there. And education is protective. If we are able to keep children in school to get to secondary school level, it brings down the fertility. It increases the human resource base and the skills. You get it. But then, because the population is so youthful, per Ghana Education Service statistics, we have about 20,000 primary schools and 13,000 GHS schools. So then, where are the rest going to? So it means we really have to plan. Population should not just be at the demand side. We just at times treat it at the demand side. So there are so many people, why not build a lot of this, why not do this, why not do, at the supply side. Those who have developed manage the supply side of population in addition to the demand side.
But they also do it by things like legalizing abortion and what have you.
You don't have to, well, abortion, in Ghana there are some conditions under which you can perform abortion. But if family planning is easily accessible. In countries where abortion was very high, when family planning became easily accessible and free, a country like the US, abortion came down. Because I don't think that any woman would want to, if you can have a family planning, a service, would have a pregnancy.
But would we need something like that in Ghana? Would we need an abortion policy in Ghana?
Well, in Ghana, you can perform abortion based on some conditions now. But I think what we need to do is to reposition family planning and make it easily accessible. Because even abortions are more expensive than family planning.
So we don't need to make it more accessible to young people, for instance?
Family planning should be made easily accessible.
Right. Thank you very much, Dr. Letitia Appiah, for your time. She's the Executive Secretary for the National Population Council. Interesting conversation there. Executive Director, thank you, for the National Population Council.